We are starting with Dr. Aparna KS on single out simple swellings first. She is a consultant oculoplastic surgeon at Chaitanya Eye Hospital, Trivandrum. Over to you.
Good evening. Pediatric lid swellings are something that we see very frequently in our clinical practice. Most of them are simple and benign, but sometimes it can present very dramatically and it can be a part of vision threatening or even life threatening condition also. So let's discuss how to single out simple lid swellings. Here we have two kits. First one with a right eye upper lid and lower lid swelling with a history of itching also. And second child with a similar lid swelling. Uh, it is associated with mild tenderness and the history is typically the swelling noticed after waking up in the morning. In the first case, we can see there is some amount of chemosis laterally, and in the second case, there is localized tenderness, induration, and a central bite mark. So, first one is a typical acute allergic edema, and second one is insect bite. Allergic lid edema can be life-threatening also, as an angioedema, which includes lips, face, and can involve the airway also. Contact dermatitis is a delayed onset hypersensitivity reaction that is characterized by lid swelling with a scaling of skin that usually improves after the avoidance of the allergen. Blepharochalasis is characterized by episodic inflammation with a non-pitting edema of the lids. Usually it is bilateral and it is followed by a quiescent stage with a cigarette paper like thin skin. And a painless lid edema can be a part of systemic causes also, as in nephrotic syndrome, that the swelling which is more during the morning and it improves in the later part of the day, and it can be associated with swelling in the other parts of the body like body and face. At another common presentation, some erythematous swelling, and you can see some pustular lesions also. And on stretching the skin, you can see the typical kissing lesions, that is mirror image type of lesions, that is typical of this blister beetle dermatitis caused by Pedris beetles. If there is painful edema with the lesions having sharp raised edges, think about erysipelas, that is a bacterial infection. And one more cause of painful lid edema. This child presented with upper lid edema. And on close examination, you can see there is erythema laterally and the tenderness at the lid margin. And it is a case of hordeolum with an evolving preseptal cellulitis. Here we have two kids with a erythematous painful lid swelling, and first one is close to the margin, that is a hordeolum, and second one is away from the margin, that is a furunculosis. These two kids with a medial candle swelling, and the first one had a history of previous watering and discharge, and droplets was also positive. It is acute dacryocystitis with a cellulitis picture, and second one is a more superficial infection, that is again furunculosis. Lid abscess is a localized collection of pus within the lid tissue which needs incision and drainage and systemic antibiotics. And here we have to rule out posterior segment, posterior involvement as we have to check for vision, eye movements and proptosis. Preseptal cellulitis is also a common cause of painful lid swelling. It is due to the inflammation of tissues anterior to the orbital septum. And whenever there is red flag signs like proptosis, diminution of extraocular movements, diminution of vision, decreased extraocular movements, RAPD, or systemic features like high grade fever or malaise, we have to admit the patient and start on IV antibiotics. And the spectrum can even include subperiosteal abscess, orbital abscess, and cavernous sinus thrombosis, which needs emergent management. Diarrhea-filariasis is not a rare disease nowadays. It can have a variety of presentations. It is a great mimicker. It can present as on and off lid swelling, diffuse lid swelling due to an actively migrating worm, or it can have a nodular presentation, as in the second picture, due to the confinement of the worm to the subcutaneous tissues with a surrounding granulomatous cover. Molluscum contagiosum lesions are whitish lesions, usually present multiple lesions with a central amplifications, and it can be associated with follicular conjunctivitis also. And particularly the molluscum contagiosum, molluscum at the lid margins may not be associated with this central amplifications. And one more, multiple whitish lesions, that is smilia. It is due to the occlusion of pilosebaceous units. It is also seen as multiple round raised whitish lesions, but it is more well circumscribed, and it is usually smaller. This pinkish swelling with a multiple whitish dots on the surface and with a history of taking bath in the common pond is rhinosporidiosis. One more pinkish lesion with a history of repeated bleeding, that is pyogenic granuloma, which is a common acquired vascular lesion, and another pinkish lesion, that is burst calacion. Here a long-standing calacion that burst into the palpebral conjunctiva, releasing its contents. Dacryoadenitis is an inflammation of the lacrimal gland. So it presents with a lid swelling in the superior lateral aspect and with an S-shaped deformity of the lid. It can be unilateral or bilateral, and it can be due to various causes like infections, inflammation, autoimmune causes like that. Another child with a superior lateral orbital mass. It is a dermoid cyst. It is a congenital hematoma which presents at the site of suture lines. So it can have an external angular or an internal angular presentation. This child, 14-year-old child who presented with a superior lateral orbital mass, on imaging, there was a well-defined isodense lesion which is suggestive of a benign adenoma of the lacrimal gland. So we did a lateral orbitotomy and sent for biopsy, and it showed typical cystis appearance. It was an adenoid cystic carcinoma, which is very, very rare in pediatric population, but it can have a bimodal presentation, can present in the pediatric age group also. So what I wanted to stress is pediatric painless proptosis and orbital mass is not always benign. Capillary hemangioma is a vascular lesion of infancy that can present as superficial strawberry nevus lesions, or deeper lesions can appear as bluish purple lesions. Here we have to rule out associated systemic conditions like Kasabag-Murray syndrome, Maffucci syndrome, Faces syndrome, etc. AV malformations or venolymphatic malformations, that is other vascular lesions of the orbit, can also present as a lid swelling with a bluish tinge. This child who presented with a history of trauma, and you can see a huge hematoma in the upper lid, and eye was otherwise quiet. One more child who presented with a history of trauma, but you can see some proptosis there and a palpable mass was there, and that turned out to be rhabdomyosarcoma. So always look beyond history because clue may be hidden. This febrile active child who presented with a lid swelling, and I noticed that there is some amount of limitation of elevation, and I sent for an imaging, and that turned out to be orbital lobe intraparenchymal abscess, and child was immediately referred to neurosurgeon. So if you feel that there is something abnormal, don't hesitate, send for imaging always. This child who was treated as chalazion and even posted for INC elsewhere and came for a second opinion. And on eversion, this foreign body material, that is a back portion of a pen, this material came out. So always make a habit of everting and seeing the lid swellings. One more interesting case, this child with a history of lid swelling, and you can see some congestion, superior bulbar congestion, and her mother bought this bottle full of different varieties of insects, and she revealed a history that her child has a habit of keeping all this insect into the superior fornix and to induce conjunctivitis, and the motive is just to escape from exams. So, stay alert. Pediatric presentations can be dramatic and even deceptive. So, lid swelling is an important sign as well as symptom. It may be benign, but it can be vision threatening or life threatening also. So, the key is to single out simple swellings and make sure that we are dealing with a harmless swelling. Thank you.